Now, in the past, when we've tried to look at the psychological and emotional aspects and maybe helping train staff who are dealing with these situations, we've focused a lot on that information giving, communication around the bad news of the diagnosis.
Yes.
But obviously we realise now that it's not really just about that point of diagnosis, is it? It's everything that comes after that. It's not even just about the surgery, it's about other treatments and then getting back into your normal life after that.
Yeah.
And there can be many steps involved.
I think for me, one of the worst things, if I could help with my experience, is to say, when you're told initially that you've got cancer, and until you've had your operation, they don't really know the severity of the cancer, the size of the cancer, what treatment you may have. I think sometimes it would have been better to be told. You are told you don't know whether you're going to be having chemotherapy or not, or radiotherapy. I mistakenly felt that because I was told some of the things I was told, and that my cancer was small and it was early stage, and that word was reinforced several times, which gives you a positive, it then became a big negative when I was called back again after the second wide excision to get more clearance. And that was looked at. That then I would need chemotherapy and that I would need radiotherapy. And then unfortunately as well, I would need Herceptin on a drip. So in a way, that was a double blow, because I'd been confident that, oh no, I'll just have radiotherapy. Sometimes I think it's better to be prepared for that sooner than have that high and then go down to that low. And then of course it meant that for me, I went through chemotherapy, and I did get through that. I did have one tricky moment in that. It's a very busy department. I felt that during the chemotherapy it would have been nice sometimes just to have, although you're told there are people there and there's a nurse there, it would have been nice to have had somebody who wasn't even medical, somebody who was non-medical, but somebody who had insight into cancer and the way you're feeling. Somebody, you know, who's got psychological support for you to be able to chat with you about how you're feeling, about how the treatment's going and things like that. Because by the time I got from chemotherapy to radiotherapy, I was at a very low ebb, and I don't think I'd even realised that myself. And it meant that therefore I had a very distressing excuse me, reaction really during one of my last radiotherapies, purely and simply because I hadn't had that dialogue with somebody, and I'd got an increasing fear of going back into the chemotherapy environment again for the next stage of my treatment. So I began to become very fearful in the radiotherapy sessions, and yet actually physically that wasn't a painful process, but you are very alone during that.
What was it that made the chemotherapy experience so difficult to tolerate?
It was the fact that the cannulations to have the drip set up was becoming more and more painful, as personally for me, my veins kept collapsing. And because of that, I had a fear then every time I went for my next session that it would be like that. You know, that would happen. And sometimes it did, and sometimes it didn't. And I did get a very understanding nurse in chemotherapy who would be very strong with me, and she would come and seek me out, and I had utter confidence in her, and because I wasn't quite so fearful, sometimes it worked and it made the procedure easier. Other times it didn't. And I think as well as chemotherapy is quite tough because you're in a very physical, open environment where people can see all your pain, they can see all your fear, the other patients. And whilst the chemo team might be used to that and used to your reactions, other patients watching that are not. And you're very aware of protecting yourself and protecting the people that can see you. But sometimes it doesn't work like that.
Now, given that you know the setup in the chemotherapy suite, you know how busy it is,
Yes.
you know their turnover, how do you think, I know this is a difficult question, but how do you think those supportive needs, those psychological needs could be met within the parameters of what they're trying to give, i.e. the drugs, to a lot of people in a relatively short space of time?
I think that, as I said before, it would be very helpful. It would be a fantastic thing if there was somebody there who, as I say, is not necessarily purely medical, maybe patients that have gone through cancer, who are strong enough to deal with others' reactions,
Peer support.
or psychological support
or something.
available there at the time for people to talk to you, because the nurses are so busy. They have such a frantic schedule to get the number of doses of chemo during that day and the phenomenal amount of patients they see. It's not possible for them to sit and have dialogue with patients. They've got to administer and do some of that, but they've also got to be aware that they've got medical issues that they've got to address. And they have, they can't take their eye off the ball with the drips and when they run out, the changeover and things like that.
So, you're making a very good point here, which I think a lot of healthcare professionals can learn from, which is that sometimes when we're trying to support staff, we support them by helping them to do more, but it's in an area they're not 100% comfortable with, i.e. the psychological side.
Yes.
And sometimes those busy frontline cancer staff, they have got a full-time job already.
Yes.
And there's only so much time that they can spend with the psychological side. I'm not saying they should ignore that,
No.
They shouldn't, but they also need help and support themselves to do that to the best possible level, i.e. with good quality. And like you say, you can supplement it with things like the peer support from other patient volunteers or psychologists, social workers and other
Yes.
multidisciplinary staff.
I think so, because as I say, it's a very fast environment medically, and there are large volumes of people coming and going with all different kinds of cancer. While I was in the waiting area, there are young people, there are middle-aged people, there are older people. They've all got different needs and different fears, and sometimes just that little chat, even in the waiting areas, instead of putting a TV screen on, which people aren't really watching because they just sat there with their fear basically, instead of doing that, it might be better to have had a more personal approach where not everybody wants to talk, but if people did, they could go to that and have a bit of calm even before they start the chemo treatment, which makes it that much easier for the medical team then to administer. It helps them to have a calmer patient. And having been both a calm patient and a very stressed out, anxious patient, then I know that happens.
And I fully agree with you about your advice there. However, there is a problem, which is that often the psychological side is not emphasised by the hospital, i.e. they're not funding those areas as much as the other areas. Obviously the medical side is usually funded because it's considered the backbone of any service, but the psychological and emotional side, that would be considered sometimes, perhaps wrongly, a luxury by some departments.
Yeah, I think that the psychological support around cancer is an integral part of the treatment, because not only do you get the physical shock of the pain and the operations around cancer and some of the side effects of the drugs and the treatment, mentally, emotionally, it is a very lonely place to be with your thoughts and your fears if you cannot talk and express them and offload them to help you become more positive in your approach to your diagnosis initially and your subsequent treatments, which may go on for many months and years, in my case, to help you cope with that. And your family are not always the people who are able to do that. So to me, that was an essential support mechanism for me. I don't think I would have got through mentally the process of coping with cancer, even though my cancer in a lot of medical terms was not as bad as as other people's, not as severe, it still was a severity to deal with for me, emotionally and mentally. And I think there's got to be quite a lot of importance placed on the support around